My name is Mark Bateman. I'm the co-founder and CEO here at WeQual. This is a WeQual Executives Masterclass. Now, we run executive sessions throughout the year for leaders at board, C-suite -1 and -2 levels within globally listed companies. This one is an open session, so if you're a visitor today, a warm welcome especially to you. I'm delighted to be joined by Asha Poulose Johnson. So Asha is working as the Chief Digital Officer at GE Healthcare. She's also a WeQual Awards alumni, which is a 2-day assessment process culminating in an interview with a global CEO. Now, Asha, welcome. You've had 25 years now at GE Healthcare, and you're a technologist by background. You've worked in many different business units, from aeroplanes to gas turbines, and now latterly, healthcare. You're from India. You've spent time in the US, and you've returned now back to India. First of all, let's have a feel for who you are as a person. Tell us a little bit about you, your family, and what's important to you.
Yeah, thank you so much, Mark, and hello, everybody. It's a real pleasure to be here. WeQual has been a great forum. In fact, like Mark said, I had the great opportunity to participate and really benefited from a lot of conversations in WeQual, and it's a real privilege to be actually having this conversation with Mark today. You are doing amazing stuff, Mark. Keep it up. Wonderful, and kudos to you and your team. A little bit about myself, like Mark said, I'm based in Bangalore, India. I, grew up as a typical technologist geek, very good at math and physics. I went on to do my bachelor's and master's in engineering, and just like all my batchmates, went to US. Initially, was having a tech career there. But I was really missing my family, and then I really wanted to come back to India. And lucky me, at that time, GE, actually not GE Healthcare, GE was a conglomerate at that point of time, was opening their research and development center here. So I was a researcher in the initial part of my career, and then I, like Mark said, worked across various industrial businesses in data, in software, in leadership, to grow where I am here from a professional perspective. Personally, I am the mother of two wonderful daughters. My elder daughter is in medical school, and in fact, you wouldn't believe it, it was her passion for medicine that actually inspired me to look at one of the healthcare businesses within GE. And I'm so glad I did that. And my younger daughter is in 11th grade. We are a little bit of an academic-oriented family. My husband is like has a doctoral degree in robotics and all. So we are a little bit academic. We love science, but yeah, we love to really bring a lot of progress.
I can't even imagine your conversations at the dinner table.
Yeah. It is not as boring as you would imagine, Mark. We also talk
robotics. How is that boring? So tell me, why this fascination with technology, Asha?
Yeah. See, my fascination with technology actually started by the fascination with science and education, right? Very early from my childhood, I was encouraged by my parents to do well academically. Because especially as India being a developing nation, I think education actually is a passport for us to have a really much more meaningful, purpose-driven, and good life. And then I could see that technology can not just solve problems, but can solve problems at scale, which other aspects may not be able to do so much. So that's really what got me fascinated to technology. The other thing is, when you're a technologist, the globe is your playing field, irrespective of where you're located, how you look. I mean, I know that's not always the case with everybody, but that's something I kind of leaned into early on, and I think that belief has really helped me through my career.
And so tell me, what's your personal purpose, Asha?
So my personal purpose is really around whether it's at work or home, doing few things well, which really matter either to an organization or to the people around you or to your family, right? Instead of just spreading yourself thing, really solving some difficult challenges, whether they are personal or professional. I think that drives me. So you'll always see me working, at something which is told as, it cannot be done, it's impossible, it's difficult to do, or some folks may say that you cannot do it because you are this person or you're located here. So I think always going after some things that were not done before, which has a meaningful outcome, not just for you but for a broader population. I think that's really my purpose, to really be a way breaker or a path breaker in that way. I think over a period of time I figured out that's something I do well, and then I've stuck to it.
And so, before we dive then into this whole topic of artificial intelligence, there's a clear connection from technology into artificial intelligence. But I know during our preparation, you also just touched on, and I think it's very important for our participants today, is this aspect of planning your career. And you had quite a strong perspective on this as well.
Yeah, so see, I wouldn't exactly call it planning your career, but I think having clarity on what is important to you at every phase of your
Mm,
career is
yes.
very important. For some, it is like going through titles. It's different things for different people. I think what for me it has been is always trying to look at, hey, does this opportunity in your career have two aspects? Does it solve a problem that is really difficult to solve, right? Because then you kind of get enamored by the problem, and then you don't need other motivations to come to work every day because you're constantly trying to solve a very challenging problem. Second, you have a great people that you work with, and that's exactly why I have stayed in the same organization for the last 25 years. People who challenge you, people who are smarter than you, people who you can learn from, a lot of collaboration and all of that. And then I think really the ability to learn something every day. So I think if these three things are, I've only looked for these three things in every role that came my way. Sometimes which I chose, sometimes which was asked of me to do because I've been in the same kind of organization for a long time, has been my path. And I just want to add also that I'm somebody who has taken some career breaks in my 25-year-old journey twice, actually. The first by accident and the second by plan, because it worked the first time around. So it was, and I think spending this was during when I had my two daughters. And when I look back, at least in my scenario, that was probably one of the best career decisions and personal
Mm,
decisions that I made. Now, like I said, everybody's career aspirations are different. But taking really time off when you're doing well in your career, and then having the opportunity to come back and then continue, I think that has been hugely important for me, and played a key role in my
yes.
career as well.
Yeah, so Asha, thank you so much for sharing that. And just before we dive into these key questions we're going to be asking you, one of the really key things in WeQual Executives is around that career decision, and when to make a move, when to stay, when to go for a stretch role. I love the sense of purpose you have. Is there a big problem to be solved, and how that has been a guiding principle for you throughout your entire career. And what's also interesting is many people or senior leaders are afraid to take time out of their careers. And actually, I say almost no matter when it happens, taking a sabbatical for whatever reason actually is extremely powerful for the reasons that you've explained. It's very scary to leave behind status, ego, money, etc., and go into a period of time where, what comes next? But almost always, that is very fruitful. So if you're in that position right now, maybe it's worth following up with us. Okay, so diving in, navigating or how to lead through AI disruption. So first of all, kind of setting the scene. And by the way, we're going to have questions at the end. If you've got questions as we're going through, please do drop them in the comments. Emma's going to be looking at those questions. We're going to have time for about 10, 15 minutes of questions at the end. So from your perspective, Asha, what does AI disruption mean for healthcare and for leadership today?
Yeah, it's a very, very important and pertinent question, Mark, because it can, the I would say the harvest is plentiful, but the workers are few kind of
Ah,
scenario, I would say. But just to give you some context, right? When we think about healthcare, it's a very complex, massive ecosystem. At the center of it, there is the patient. Surrounding the patient, there is the hospital, the clinics, the doctors, the nurses, all of that. the healthcare ecosystem. It leans on companies like GE Healthcare for medical devices, to provide with, a lot of imaging solutions and other solutions that really help with diagnosis, which makes things to be known much sooner than later. There is the whole companies like Cerner and Epic, which is providing EHRs and all of the technology for the hospital ecosystem to run. There is the pharma companies. Outside of all this, there is the insurance play, because that's very huge. End of the day, financial models are very important in any ecosystem. And then there is a government. There is a lot of government like regulation. It's a highly regulated industry. There's advocacy. So as you can see, there is a lot of different players, all who need to come together for this patient to see the improvement, which is a little bit different from some of the other industries like an aircraft industry or a power generation industry that I have worked with. Now, the good thing that is happening is there is a lot of AI enhancements or infusion happening individually in all of these. Like for patients, now we have so much more information with Fitbits, handhelds to track our health, right? So we've become more intelligent. We feel we have more control over our health. Hospitals have implemented a lot of advancements using in clinical system workflows, infusing AI into it, which has improved the AI, the benefits of AI for hospitals. And I can go on. Like, for example, GE Healthcare in medical devices, we are putting better AI into our devices so that we can diagnose faster, sooner, more accurate, cheaper, etc. Right? So this is wonderful, and this is happening. But if you look at it, right, why I made that statement is because end of the day, if you really see, and we all experience this every day, as how much benefit do I now get as a patient from a year ago or 2 years ago, while I daily hear about everything that OpenAI is doing, and there's so much detection happening, and there's so much of advancements in medicine, in drug can now be manufactured, the cycle time of drug manufacturing and creation, all of this, how much benefit do I get as a patient? I think that's a question. It varies by country, by region, by where you're getting your care. I think that's where the ecosystem play is very important. So unless every player is having a benefit, it's going to be challenging for AI to truly benefit the end consumer or customer for this, who is the patient. And just to add to, you asked a question about leadership. So in this context, it's more about ecosystem leadership. So it's not about leading your organization, but how do you lead with others to really achieve this purpose? No one individual organization or even one of these groups alone cannot really impact, which is very unique to healthcare. So a lot of progress is being made, and AI is really starting to change. But interoperability, things like interoperability, horizontal leadership, all of these things are going to be extremely important. And if I may just add an example, from the recent valuation that game that is going on between OpenAI and Microsoft and NVIDIA, I think you see that's kind of an ecosystem play that's happening on the tech side, right? Yes. I think something similar, I don't know how that's going to be, will need to happen for the whole overall patient to get benefited.
That's fascinating, because I mean, that's really interesting to see how OpenAI have invested, right? Or sorry, how NVIDIA invested in OpenAI. And as you say, you have this ecosystem that's building up where previously you may have had disparate players. And for sure, this is something that I haven't really thought through, is that how the whole ecosystem needs to work together and how individual parts are utilizing AI, but how do you streamline across all of those different parts, for example, to provide healthcare to an individual patient? I just want to share a slide, and this slide comes from my book, but I think it gives us an interesting framework. And I want to ask you 3 questions in context to the FIRE leadership model. So in this fire leadership model here, you will see that, so a fire, by the way, a fire is always disruptive, much like artificial intelligence, and it can either be positively disruptive or negatively disruptive, right? If you've got a fire that breaks out in your house, not a good thing. If you turn on your gas hob to heat your kettle, that's a good thing. And then to have a fire, you need heat, fuel, and oxygen. And so I'm interested, Asha, in terms of how this applies when you're thinking about AI strategy now as an organization. Because how do we lead through AI disruption? So my first question is going to be on heat in terms of how you as an organization and as a leader set the vision and the strategy. And then we're going to talk about those resources, people, cash, and maybe actually the wider ecosystem that you've just been speaking to. And thirdly, the oxygen, those that we're seeking to serve, our customers, the market. So thank you. Let's drop that slide and come back to you, Asha. So first of all, and I'm going to ask just for maybe 2-minute answers to each of these three questions here. But taking that first component of fire heat, how does GE Healthcare then define its purpose? And what role does AI have to play in achieving that purpose?
Oh, this is a phenomenal question. See, we are one of the things I'm very privileged to be is working for a company whose purpose is to create a world where healthcare has no limits. And I think that kind of sets the tone, for a company
Right.
that operates in 150 countries and has imaging scan happening somewhere in the world using its devices every 3 seconds. It's really about improving accessibility and affordability of healthcare. Sticking to your 2-minute rule and coming to the AI part of the equation, there are four broad areas where AI plays a role. One is in our products, and this is not new. Maybe it was called algorithms before, machine learning before. A lot of our programs have a lot of software in them. Whether you look at MR, CTs, PACs, ultrasounds. I mean, we have a whole plethora of medical devices, right? They all come with either solutions that have software on top of them that enhance diagnosis or are inbuilt in helping the device perform better. So that's one, which we've been doing for a long time. I think we have now new AI models that we can use. There are new compute that makes it cheaper for us to use large foundational models and all of that. So that's one. I think the second thing is how, if you look at a company that has 100,000 of equipment all over the world, which are all connected, one of the biggest things our customers expect of us is making sure that there is no disruption to the operations of these devices. So we use a lot of AI to really do preventive as well as predictive maintenance, so that there is no downtime to any of the devices, any MR, CT in any of the hospitals where we have, obviously those agreements with customers. Thirdly, we use a lot of AI now, starting to do a lot more that generative AI, or using agentic AI internally, so that we can provide a lot better of customer experience and drive productivity through for employees. And I think this third bucket is something many companies are doing, right? Business productivity, employee productivity, and customer experience. So for us, it's in those three buckets. First is about our products. Second is about our service, and third is about our own employees.
Right. And so then coming on to the fuel question. So now it's about cash, culture, your resources. What has been the most important in terms of mobilizing your people and your culture and your resources to enable AI at scale?
Yeah. So see, I just picking back on my last answer, right? So when you think about AI, there is AI for the individual, and then there is the AI for the organization. If you leave the product stuff apart, right? When it comes to and AI is like, some basic skill, like it's like my daughters tell me soon AI will be like knowing how to read and write. And by the way, they are both in non-tech professions, like I said, but every profession is now tech. So I argue with them. So it is really about how do people look at, and how do you have that mindset of looking at AI either as an opportunity or as a threat. And I think at an individual level, I think that's very important. So who are the early adopters? How do we create community forums around them so that they can bring their friends along and all the others along, right? So that is a huge thing around how can every employee use AI to do their work better, and be more efficient, right? So that's one stream of things. The second thing is really around business productivity. So this really depends on the maturity of your data, your systems. How can you drive business productivity with agentic AI? I mean, all these fancy words look really nice, but end of the day, if you want to really deploy an autonomous agent, you cannot do that with a 50% data accuracy. Imagine your customers getting wrong calls that their equipment is down when there's nothing really wrong. I
Right.
mean, or there's something seriously wrong and they don't get a call, right? Both are really devastating things. So I think that's where data, the value of core foundational data, I think is going to be extremely important for driving pure business productivity. We can get some Gen AI solution, a lot of word automations and things like that. So in order to do this, right, it really requires a lot of investments in tech platform, and AI literacy from top to bottom, so that people are just not getting bought into thinking that suddenly an agent is going to do a lot of things without having the underlying investments in data, more importantly ethics and governance. So one is a personal transformation, which is like each one catch one teach one kind of thing, right? And that kind of progresses. And the other is truly with a vision, a strategy, identifying few areas where you have good data, you have good problems, you can see the ROI, and then investing. So it's a little bit of a twofold approach, and the cultural tenets kind of follow that.
Okay. I would love to carry on asking you about that because you must have so many requests from all parts of the business saying, hey, we can use AI for this, we can use AI for this, and you have to make that decision. But I'm going to move on to the next question, and maybe we can ask that question later. So in terms of your oxygen, your customers, your market, and you've already talked a little bit about this. So can you share examples of how AI has improved outcomes for patients and other stakeholders?
Yeah, so let me talk about one example which is very close to my heart. Okay, so we have this product. It's called VScan Air. It's an ultrasound, which is a handheld ultrasound, which is amazing by itself. You know, it's like doctors were carrying stethoscopes. Now they can carry ultrasounds.
Amazing.
So that's brilliant. However, the challenge is it was not easy for people to use who are not really trained radiologists, right? So while you have now a lot of these available, how do you expand the reach of it? And that is where AI really came to play. So now we have something called caption, which goes into this product, which then tells even a trainee or somebody who is not,
Mm.
who has the ability and can be trained to use this ultrasound, because AI tells him, hey, this is a heart, this is a lung, and it starts detecting things for them. So then suddenly your reach of really using ultrasound, which is one of the safer ways of doing, doing diagnosis, especially in a lot of parts of the world where accessibility is a huge challenge. I think it starts solving for it. So this is a real example, or one of the most
Mm.
interesting examples, which there are a lot of hospitals or other clinics in different parts of the world, some even remote, where they don't really have a lot of doctors, trained doctors can do this. And sometimes they even combine it with teleradiology and telehealth solutions, which really dramatically changes life expectancy. It can help with expectant mothers. I mean, it can help with even detecting early heart disease, which is the number one cause of death in the world. So it is a good example of how AI can really start changing when the use case is very strong. Let
Mm.
me give you another example, right? So this is not just about AI. See, AI is one of the enabling technologies. Usually, it needs to work with several other technologies for it to actually come to add value, right? So, for example, let me just to go back to like an MRI machine, right? It's a pretty big capital investment for a hospital to acquire one. Earlier on, right, when we were kind of working, we would need to. It would be a very complex process to improve the ability of that MRI. But now technology is evolving around us every day. So how do you actually use software and subscription models in combination with AI so that at any point the hospital has the latest tech on their MRI? And if they want, they can also use a combination of financial models that help them to kind of spread their spend over time. So now, while AI is a player there, you can imagine that it's the whole ecosystem that came together to probably help and organize the solutions. I can go on with many more examples, which are real, but I just want to give some couple
No,
which may not be so obvious.
I love this, and I know in our preparation call, this really stood out to me, is this affordability and accessibility, where you're taking medical care into regions that previously didn't have it, and you're providing cost models because of innovation that you have what previously was a dumb machine, right? Just a machine that did one job. Now you can update the software in there with the latest AI software and whatever else, and deliver so much more value as an ongoing subscription service, which I just think is remarkable. So you can provide services in places like war zones or across regions where maybe there's one hospital, for example, in Africa, where there's maybe one hospital in a very large geographical area. So I find that really exciting. You know, we hear so much about the existential crisis that artificial intelligence might bring, right? That we're going to be ruled by machines, and yet here we see a really good example. Actually, it's going to benefit so many. Can we just share the next slide in terms of AI maturity framework? And I'm intrigued, Asha, when we look at this slide. So again, this is from my book, but I talk about 3 levels of thinking, and really sustainable competitive advantage comes from level 3 thinking, which is this purposeful disruption. But what we're seeing is a lot of organizations, to begin with, from an AI perspective, look at that operational efficiency. And actually, you've spoken to that in terms of, you know, finding individual champions, finding those early adopters. You're looking for efficiencies. Then in terms of level 2, it's about strategic alignment, utilizing AI to really help you drive your strategic objectives. And then third, actually, is how you use AI to really, truly drive purposeful disruption. And that is where true transformation at a societal level can happen. So my question to you here is, from your experience, i.e. of the sector, healthcare sector, or maybe AI more in general, where do you think organizations are right now on this maturity ladder?
See, I have seen organizations across the spectrum, right? I've seen more of retail and those kind of organizations that are in the L3 bucket because most of what they need to do has very little impact on human life. For industrial companies, for health tech companies, to do that is we're not there yet. Like, we have data problems, we have ethics, don't have all the rules and regulations and all of that, right? When we think about this maturity curve, right, the one thing that I have observed is, for any company to go through this curve, and you may see that the same company is in different buckets in their product, services, and what they do internally. At least that's what I observe. The most important thing is alignment at a board level, right? If this is not a board level priority, if this is not a leadership priority, I think the whether it is operational efficiency, strategic alignment, or purposeful disruption is going to be weak. When it really comes to the way of working at a purposeful disruption level, I think it has to be identifying the value at an ecosystem level, and then focusing on 2-3 things that can really be game changers. And the one thing that we need to understand is we need to have a little bit of different thinking when we think about technologies companies who are building AI in their maturity framework, because their purpose is to build AI for the world, right? So I think most of those companies, you would find them in purposeful disruption. And then on the other hand, you have companies who are the businesses who need to now consume all this AI, right? And that's where this maturity curve is really important. And I think the important thing is you are on somewhere on that curve. I think that's the first victory.
Right.
You need to do a lot of experimentation to figure out what works in your industry, what works in your organization, because data plays a key element. When you do operational efficiency, it's less because you're doing a lot of automation of paper and PDFs and all those kind of things. But when you move to the other end, it is really like an autonomous business. And for that, like I said, you cannot have a 50% data quality, right? So I know it's not a direct answer to your question, but it is a framework that is very unique to an organization, unique to the industry. But the important thing is understanding where you want to play, what value will it bring? Because if it's not bringing value, nobody is going to persist with it over next two, three iterations.
Can I ask you, Asha, as well? And this is a question that's just come to my mind. But when you're looking at that maturity model for AI, I'm intrigued as a chief digital officer. What's your split of time between these three levels? Like, how do you determine how to spend your own personal time and energy when looking at these three areas?
I spent most of the time trying to figure out three,
Right.
doing two, and let others do one.
I love that answer. I love that answer. And yeah, okay, great. And that's, I think that's the biggest challenge for any senior leader is to carve out the time, right, for that level 3.
Yeah.
So you think about level 3, you do level 2, and you delegate level 1.
Yeah.
Okay.
That's what I do.
And looking ahead then, and then we're going to come to questions. So looking ahead, what's the next frontier of AI in healthcare? And what kind of leadership is it going to demand?
Yeah. See, I mean, I think we've talked about a lot of things on where disruptions in healthcare can happen. I think the next frontier is really making that vision to start coming true. Because we don't have a lack of vision or a lack of ideas or a lack of, what we can do. I think it's really about how can we move the needle to get there. Because our pace of execution is much slower than many other industries, rather than the pace of vision. I think a lot of technologies around, which are really related to vision, and a lot of technologies which are related to video, those kind of technologies are not so prevalent. I think those will come. But see, end of the day, this is not a technology problem at all. We are extremely good with technology. We have phenomenal technologists in the world. So it's going to be what new use cases can we serve in healthcare that we couldn't serve before with technology. I think that will be the real frontier. And the companies that are going to crack that are going to be the winners. What kind of leadership this demands, right? At least from my very humble perspective, I would say three things. The first thing is, how can you lead horizontally? Horizontal leadership requires listening. And then once you listen, how do you develop collaboration? How do you influence? And how do you look at win-win solutions? Because only then ecosystem plays can happen. So I think horizontal leadership is going to be very, very important. Most leaders will need to be AI literate, because it's not something they would be able to delegate anymore. They would need to know a lot of things about AI ethics, because they would be responsible for it. And the third thing, which I actually discovered earlier this year when I was listening to one of the authors who really talked about emotional agility. And I think that's just to explain to it, what it means is, because of the change of everything that's happening around us, we are going through a lot of different emotions every day. And how do you regulate those emotions, still stay focused on your goal, and manage through that is going to be a key skill I think a lot of leaders are going to need. That it's a book by Susan David. She's a Harvard professor. It's an amazing book. And it really talked to me about the need for emotional agility. We talked about all other kinds of AI agility and all, but how can you be agile with your emotions as a person, as a leader? I think people who are strong at it are going to make good leaders.
And is this, before we go to the questions, is this something that you've struggled then with, this emotional agility piece?
I did not understand my emotions very well. That's something that happens when you are too much of a geek and a technologist, right? And I used to wonder, why do I sometimes get annoyed when some things don't happen. I think it really spoke to me, but more importantly, it spoke to me that now it's going to be even more. So you better get a handle on it.
Okay, so my final question. One piece of
Okay.
advice to everybody who's listening right now, who is in a position of leadership. What one piece of advice would you give them when thinking about artificial intelligence?
I would, first of all, please don't have any FOMO for artificial intelligence, right? You can have a lot of time to
Everybody
learn
has
this.
FOMO. Everybody has FOMO.
So, and the thing that you will learn about artificial, in there is no end to the learning. You learn one, you learn another. So that will be my very simple advice, that uh, just learn the basic things and try something. Don't sit on the fence. Get into the water. Get into swim, and soon you will figure out, oh, swimming is not that difficult. So I think that would be my one piece of advice. And then I would kind of think about what problems can you solve, even when you know a little bit. With this little bit, what problem can I solve? Because
Mm,
it's not so much about the learning, it's about
yeah,
the outcome. And with the little you know, if you can solve something, you are
I
better
like
off
that.
than somebody who knows a lot of AI.
Yeah, I love that. Okay, thank you so much, Asha. I could do a summary, but I'm going to go to the questions. And Emma, I'm hoping in the background people have been asking some questions. Now is the time if you have questions. Emma, do we already have some questions?
We do. Hi, everyone. Asha, that was amazing. I'm going to come to Stephanie, if we're happy for people to kind of come and ask their questions directly. So we've actually got two from Stephanie, if you're still there.
Yes, I am. Hi, everyone. Hi, Asha. I've absolutely no doubt that there is endless opportunities with AI, and my to-do list is very long already. But my challenge is starting with the data. I'm working in the FMCG environment. We are a lot of companies still, hooked in how do we structure, clean, and make the data available, because the output is as good as the input is. So, and the journey is already far, So my question is about any specific tip to enable acceleration of the roadmap regarding the data structuring, cleaning, and making them available from a financing, resourcing point of view, as well as execution point of view. Is there any shortcut?
I wish there were.
Magic trick.
Oh,
Please.
Stephanie, I love that. Is there a shortcut?
But let me tell you few things I have done. I'm sure anybody who has worked in data, and I've worked for a long time, this is your everyday challenge, right? So I think the first thing that I have done, which has served me well, is to understand with what I have, what is possible to do, and identify those use cases, right? Rather than starting with, okay, if I solve and clean up the data, I can do something. Because when you do something for somebody, they will invest in you, which you can use to further structure your data, enhance your data, and then go from there. So that's something that has worked. Because however, while we talk a lot about data quality, however little data you have, there is something that you can do which is better than nothing, right? So so I would start there. The second thing I would tell you, which we do a lot in my group, is actually use AI for data structuring, data cleaning, and a lot of that, right? So for example, when we work on something called anomaly detection, we are basically trying to find one event that is wrong in millions of events, and it can be very challenging, right? So we do create, we look at algorithms that can actually fill in the gaps within data, and then use those data to further do it. It's a little bit of a technical topic, but that's the other thing we do. How do we use AI to improve our data and then go from there? I wish I had more tips for you, but these are only two that worked for me so far, and that's what I can share with you.
Thank you. So I'm just going to my second question then, which is, of course, connected. In order to do all of that, we need to find some, resourcing. You talked about the fact that it needs to be on the agenda of the executive committee, of course. But then, is there any correlation between your AI roadmap progress and the headcount evolution in your company? Are you making it intentional? Or is that really based on the third pillar? Is that really about value creation for the business, or both?
See, just like any new technology, it needs investments for it to start flourishing. We can always do some pilots, which will not sustain with very limited resources. If it's important, that's why I was saying if it will work if it's a board agenda, if it's coming from the top, right? Not to be hierarchical, because if that is not happening, this is difficult as it is. It's eventually AI is like a transformation that needs to happen. It's a change that needs to happen, and for that change, you need to have some level of investment. Investment can be financial, investment can be talent, investment can be expertise. Uh, I have not yet seen where without a proper investment, it need not be big, because you can have a smaller ambition, and based on that ambition, you can grow, right? Without that, you can actually be changing. I mean, I haven't seen a lot of examples of that, because tech is not cheap, and there is a lot of core talent that is needed if you're really looking at doing strategic stuff. If you're doing operational efficiency using Copilot and GitHub and all of that, which to me is a low hanging operational efficiency in Mark's model, I think it's still doable. But when you get to the second and third level, I think having strong investments are very important.
Thank you, Stephanie.
Thank you.
Thank you.
Right. Our next question is from Pratyusha.
Yeah, thanks, Emma. And thank you, Asha, first of all, for your insightful session. And my question is around now, Stephanie has rightly mentioned in FMCG industry. I work in pharma industry where often for any problem, tech solutions are the first priority. That, for example, now we have been talked about data cleaning, data validations, data pipeline building, all this stuff. But without having data governance as a process in place, how is it likely that our AI agents will get succeeded? Because I'm from data governance team, so it is always been my pain that majority of the stakeholders or within the organization itself, many of the people doesn't see the value of data governance. Rather, they would believe rely solely on the technical solutions that are available. So
Yeah. And see, in the AI world, it's not just data governance, it is AI governance. You need to see your models are not hallucinating all over the place, right? So, uh, well, is data governance important? I think in an AI era, it is even more important. I think how it gets structured, how it is structured in the organization can make a profound difference on whether it is viewed as an asset or a liability, right? So I mean, I have seen organizations where data governance is a lot more federated, and it has shared accountability across different functional business technical stakeholders. uh, have found this to be a lot more effective than it being a very central organization. And it's very difficult for a central organization to really know everything that goes around everywhere, right? So while the challenge of value for data governance continues, there are ways to show what is the loss of poor governance. I mean, in pharma, I can only imagine how critical that would be. Like if you didn't have proper governance, how challenging it could be. It could be one of the ways to demonstrate value. However, like I said, it's more about how data governance get operationalized that sometimes makes it like an asset versus a liability. So I don't really know how your organization is structured, but I would encourage you to look at not to also think about how do you look at data governance organized differently. Maybe there is lot more shared accountability for it.
thank you.
Thanks very much. I have a question here, which is when thinking specifically around specific initiatives that help shift culture or build capability quickly, what have you seen that works?
I actually was in charge of something like that very recently to help our company transform into software subscription models, there are three things that really helped us. One is obviously it was a priority by the CEO, so that helped. But see, it's not the people at the top who have to actually do a lot of things for a transformation to happen, right? A transformation is as successful as at where the foundationally the shift needs to happen. I think having a very, very broad cross-functional team in the beginning, doing a lot of listening sessions initially, and then quickly putting together a roadmap, which may be right or wrong, but having a roadmap sets everybody to see, oh, something's going to happen. And then attacking the small thing at least gets that small thing done. And then you can move from there. For any health tech company to move into software and subscription model is very challenging. So you can imagine that maybe we've still not there, but we've made a lot of progress. It works. I believe that it can be scaled to other areas as well. So it's the leadership buy-in, of course, associated resourcing and funding, but more importantly, how do you engage at the top and at the bottom at the same time and feel like it's everybody's agenda rather than the agenda of a few? I think core change management principle, but then showing quick progress, and not getting kind of weighed down by if something's going to be really right or wrong in the initial days. It helps build. There is nothing that really helps build success as something that works and people start to touch and feel it and make progress. So some of those things have really helped us.
And another question, Asha, is in terms of the AI strategy that you have within GE Healthcare. And tell me if you can't share this publicly because I would understand, but I'm kind of intrigued as the role differentiation between you're responsible for this part, and then your executive committee, who will not have anywhere near as much idea in terms of the data, the technology, how everything hangs together. How do you both set the vision and the strategy as the chief digital officer? How do you get your exco on board?
Yeah, so I just want to clarify that we have many people who are multiple, digital officers, data officers, who are all responsible for different parts of the AI strategy. I'm not solely responsible for it, right? I think the way this has been working, at least for us, is that we've identified what are the biggest areas that probably AI can either help us as a company internally or help our customers with the right solutions and products.
Right.
And then double downing on them, it has been to me important. At the same time, there has been a lot of communities of practice that have been launched, which generally improve the AI literacy within the organization, providing avenues for anybody who's interested with Copilot licenses, all of that, wants to do different levels of experimentation, learning, celebrating successes, not just the big ones, but somebody who was in a finance function now has created used AI and now completely automated their a lot of stuff they do. I think recognizing those have helped create a little bit peer pressure as well as really help build that culture out. Uh, Again, I just want to be clear that there is no silver bullet, just like any other transformation. It depends on the industry that you're in, how mature you are in that space, how good your technology platform data is, and how strong your organization's leadership is invested in that shift. All of these things need to come together in some degree of measure, I would say, for that to happen.
And a related question to that then is thinking about agentic AI. We were working with a large pharma company, and we had this really interesting conversation about, not only how we train or develop leaders and managers to utilize AI, but actually where humans are managed by AI. What's your take on this? Quite interesting and potentially extremely disruptive way of working.
Yeah, so see, I think we are still like exploring how that's really going to operate. I have seen organizations go that path and shut it down. I've seen organizations go that path and be successful as well. And I'm not very sure that there is a need. See, there is this AI could be more of an intelligent system than like one AI, right? Where you get into an autonomous thing. And there is an element within it. There needs to be a human intervention, or there are some tasks that can only be done by humans in that business or in that process, right? So I don't see the day to be very far where we will have a world where AI agents and humans and AI systems will all work together. But I think they will mature very slowly at a large scale. Maybe they're in pockets, they will work very well, but that doesn't really help a specific industry to transform and adopt AI. It will happen only at the pace where this is now scalable and it's acceptable and everybody is comfortable with that mode of working, right? So it is here. I see it is here, but then some companies are going forward, coming backward, some are moving forward. So we are in that very very nascent phase of autonomous agents and AI. See, I've been like hearing about autonomous car now for 10-15 years, and I think it's still not there yet, right? So it's going to take a while. When it's about fully autonomous systems, it's the ecosystem that needs to be supportive more than just the system itself. So if the ecosystem is fully not there, I think it's going to be difficult. So certain industries where they're independent, they'll move faster, and certain industries where it's more about an ecosystem will tread along.
So I'm keeping an eye on the time. So we've got 5 minutes. We've got one more question, and I'd love to run we're going to run a net promoter poll now. In fact, if we could do that just now, and then we'll come to the final question. So we always run these at the end of every single one of our sessions. On the basis of this session, how likely are you to recommend WeQual to a colleague? That poll should be appearing on your screen now. Thank you. If you can't see the poll, feel free just to tap a number into the chat. This is really helpful to us. Based on your experience of today's session, how likely are you to recommend WeQual to a colleague? 10 is high, 1 is low. We will send out an email after today's session with a feedback form. Your feedback is so important to us. I'm just going to give just 20 seconds before we move on here. There is a second question, which is, what did you like most about today's session? And third, what can we do to improve? Just feel free to type in a few words. I can see how many people are responding.
One of my earlier bosses told me feedback is a gift, and I really love that you are doing this, Mark.
It's like gold dust for us. As it is, I think, for anybody, right? It shows whether you're doing the right thing or whether you need to change. So I can see we've had 8 respondents so far. I'm looking for a few more. Thank you. And once you've submitted, that poll will disappear. And just whilst you're finishing, so this is a WeQual Executives session, just a 15-minute description. So WeQual Executives exists for senior leaders at board, C-suite, -1, -2 levels from the world's largest companies. It's truly global. It gives you a peer-to-peer network. We provide executive development on the types of topics that matter most to you to help you increase influence, impact, and career progression. And we enable the sharing of best practice. So if you'd like to find out more information about that, please visit our website. We will be sending up a follow-up email. Asha, so the final question, and I'm going to read it, if you don't mind, Annalisa, I'm just going to read your question. So thank you, Asha, for sharing your experience and vision. My question is on ecosystem leadership. In your experience, is that a characteristic linked to a specific gender, or is it gender independent?
Oh, this is a brilliant question.
Right.
I feel, and I have observed, not I feel actually, I have observed that women actually display this skill a lot better. And the reason for that is, that's somehow in most cultures, I would say, the roles that women tend to play naturally. And I think it is something that I have observed. So I do think that it's going to be an advantage for all of us here, and for I mean, this is not like a one, black and white thing, but in general, I have observed that's the kind of observation that I have.
I love that. I love that. I've just made a point. So I try not to make too many notes when I'm interviewing, because I want it to look like on here that I'm really focused on you. But I've tried, and forgive me if you saw my eyes wandering. So I just made a few points throughout. So number one, Asha, I've just found your responses so practical, and I think there is a sense that oh my gosh, we're going to talk to the chief digital officer of GE Healthcare, this big global corporate conglomerate, and yet you're so human and you're so practical. And I think that's true for all leaders everywhere. But I want to thank you for that. So just some very specific points you brought out. You're part of a wider ecosystem, and that aspect of horizontal leadership. And you touched on NVIDIA investing in OpenAI, or as an example. And I think this is going to be a really distinguishing feature of this next phase of the AI revolution, is how companies and how us as senior leaders are able to manage or lead horizontally across that ecosystem. And I love this last question, because we know that more feminine trait is about collaboration. It is actually better emotional intelligence in many cases, and being able to build and nurture new relationships. So I find that really interesting. To ensure that as a leader, you are AI literate, and actually very practically start where you are. And again, that's very practical. So we think, oh my gosh, I've got to go and do this big course, and I've got to learn everything there is to know. And even I myself, I find myself now thinking, gosh, there is so much happening every single day. Should I just give up and just leave it to those that are in this space? No, start where you are. Third, data, and this kind of came from what Stephanie was saying as well, but start with what you have and what is possible today. Again, so practical. It takes the pressure off. Start where you're at right now. And also, how can you utilize AI to clear up and tidy up that data, whilst also ensuring that governance piece? And if you saw in the chat, Sven had a really good comment on that as well. Mm-hmm. It needs to be a board agenda that leads to investment, and less in a sense about level 1, more about level 2 and level 3. So that purposefully disruptive and just strategic alignment. And actually, as a very senior leader in this space, you spend most of your time thinking about level 3, which is purposeful disruption, doing level 2, which is strategic alignment, and as much as possible trying to leave level 1, the operational efficiency part, to others. So those were my takeaways. We're 1 minute past, so we definitely need to end there, but it's been our absolute pleasure, Asha. We thank you so much for spending this time with us, and everybody who's participated today, thank you so much. It's been wonderful to have you here today, and we look forward to seeing you at a future WeQual Executives event.